All right, moving on to our last lecture of the unit. It'll load for us. We're going to transition back to talking about skeletal muscle. Okay. First things first, just kind of introducing some stuff about skeletal muscles. Most of these skeletal muscles, it doesn't say skeletal, so we just have to know that's what we're talking about. Most of these muscles of our body span at least one joint and attach to both bones forming the joint. So we're going to see at least one, what we call origin, and one or more insertions. And when that muscle contracts, one bone will remain stationary while the other one moves. The origin insertion that I was just mentioning referred to the points of attachment. The origin is the point that does not move when the muscle contracts, whereas the insertion is the point of attachment that moves when the muscle contracts, which means that when a muscle does contract, the insertion moves towards the origin. Okay, like we show here, if we're doing a bicep curl, flexing the elbow, the origins, actually in this case, because the biceps has two, are located up on the scapula. The insertion down on the radius is going to pull the arm up towards the scapula, thus causing the insertion to move towards the origin. If we were doing the reverse of that in an elbow extension, we'd see the exact opposite in the triceps. Okay. Now, the region between the origin and insertion is the fleshy part of the muscle, which we can call many different things: belly, body, or gaster. Okay, I rarely, if ever, will call it a gaster. It's usually just belly or body. Okay. Now, shown down at the bottom is an example of two muscles that work against each other. Okay. The biceps and the triceps. And we see this same situation kind of throughout the entire body, because when muscles act, generally they don't act individually, rather they act as a group. So we have these opposing or antagonistic pairs at many joints, like flexors, extensors, adductors, abductors. In the case of a bicep curl or a flexing of your elbow, the biceps would be your prime mover or agonist, the muscle that's directly performing the specific movement. In that movement, we call an action or function. Whereas the triceps in that example would be an antagonist, the muscle that directly opposes the agonist. Now, if antagonists are relaxed while the agonists are contracted, movement will occur. Okay, we can't have these contracted at the same time, because if they are, no net movement occurs for the joint, because they cancel each other out. Okay. Now, sometimes a prime mover crosses other joints before it reaches the joint at which its primary action occurs. Your biceps is an example of this. It crosses your shoulder, but its main job is to move the elbow. Okay. We have what are called synergists, which are muscles that contract at the same time as the prime mover and facilitate the prime mover in order to produce a more effective movement. Anybody ever heard the term synergy before? Synergy is a kind of a buzzword you see in a lot of corporate settings. Just a fancy way to say work together and be a good team. Okay. That's what synergists do. They work together and they produce more, and they're more effective, more efficient. Okay. They contract and stabilize intermediate joints, so they would like help hold the scapula in place, located close to the prime mover generally. Fixators contract and stabilize the origin of the prime mover in order to maintain joint stability, posture, and balance while the prime mover is working. And in other words, they could say, they study the proximal end of a limb while movements occur at the distal. So in other words, they help hold or fix. A fixed joint means it's not moving, like the shoulder in this case. So like your trap muscles that attach to your scapula prevent the scapula from, when we're lifting something, the scapula would want to kind of come over the top of our shoulder, which will be very terrible, so they help hold it in place. Now, under different conditions or under different movements, we could say, and at different times, many muscles may act as prime movers, antagonists, synergists, or fixators. Like when we flex our elbow, the biceps is the prime mover. When we extend the elbow, it becomes the antagonist, as the triceps becomes the prime mover. In the free limbs, a compartment is described as a group of skeletal muscles. They're associated blood vessels, associated nerves, all of which have a common function. Examples include the flexor compartment muscles, but we really should say which are generally anterior. Exception to that rule will be the ones that work on your knee, because you flex your knee backwards instead of forwards like you do for your elbow, for your shoulder. You flex that forward, you flex your hip forward. Your knee flexes backwards because it bends backwards. And then extensor compartment muscles are generally posterior. Picture on this page is not important, just the information. All right, in our last lecture, and we started really kind of talking today just about that at the beginning, we were talking about muscle shapes. We find a lot of importance in a lot of different types of muscle shapes. So let's cover that now. Okay, so recalling from our previous lecture, which is not hard to do because we were just talking about that like 15 minutes ago, skeletal muscle fibers or cells are found within our muscle and are arranged in bundles called fascicles. Okay. Within a fascicle, all muscle fibers are parallel to one another. Talked about that today. Fascicles, however, can form patterns within the muscle with respect to the tendons. Okay. If you look kind of hard enough in these illustrations, you can kind of see some lines between or within the red part, which would be the muscle part. The white would be the tendons. Okay. And the importance of understanding the direction that these fascicles run is because it affects the muscle's power and range of motion. Now, our most common type of muscle, as it states here, are just parallel muscles. Okay. Like that brachioradialis that I was showing you in the picture, where essentially the width is uniform all the way across, and so all the fibers are running, and all the fascicles therefore are running parallel to one another. Example, sartorius, which is down in our thigh. Convergent or triangular, I bet you can figure out why I call them triangular, have fascicles that radiate out from a small to a wide point of attachment. So wide, here's the small. Example in your chest would be your pectoralis major. Okay. The next three are called pinnate muscles. You have a uni, a bi, and a multi, which aren't labeled, but you might want to do that. Unipennate, uni means what? One. Okay. They have fascicles anchoring to only one side of the connective tissue shaft. So essentially the tendon kind of has an extension that projects to the side, and therefore the fascicles radiate out from that. Bipennate to me always kind of looks like a feather, where it's kind of got that middle shaft in the interior of the muscle, and then the fascicles radiate out from it. Example of that would be your rectus femoris, which is a important thigh muscle. And then multipennate, like your deltoid, it's kind of like multiple feathers connected to one central turn tendon or one common point of attachment. Okay. Fusiform look a lot like the top one there, parallel, except they aren't uniform in diameter throughout. It's skinny, fat, skinny. Kind of look like an elongated football. So they have fascicles close to the belly of the muscle, but converge to a tendon at one or both ends. Brachioradialis, I actually mentioned already. I said that was parallel. It's kind of a little bit more, I guess, fusiform, although it looked like it was pretty well parallel. Circular, probably pretty common sense why we call it that. Also known as orbicular or sphincter muscles. They are going to circle around body tubes or openings, like around our eyes, which is what your orbicularis oculi does, and then the external anal sphincter, which surrounds the opening to your digestive tract at the tail end, I will say. As far as the pictures go, do actually know them, because I want you to be able to identify, like, this is parallel, this is convergent or triangular, this is unipennate, etc. All right, naming muscles is something that's very important. Really will help you tremendously as we roll through this lecture, where we start identifying the different muscles of the body. There's a lot of different ways that we go about naming muscles. You can see as you guys write them all out. All right, let's talk first about location. Many muscles are named as a result of their location in the body. So thinking back to our very first lecture of the semester, when we saw the lady from the front and the back labeled with all those arrows pointing to different parts of the body, and we learned that there were functional names for things like your upper arm, which is your brachial region. And I talked about, and I had you guys all demonstrate how important that is to understand by telling you guys to point to your biceps muscle. Everybody obviously points to your upper arm, and then I said point to your other biceps, but I said don't point to the other arm, okay, because you have a biceps brachii and you have biceps femoris muscles. Okay. We use location a lot with regards to muscles. Okay. For that reason, you should know right away where your brachialis muscle is. Your upper arm, right? Your brachial region. Okay. We'll have many questions, a lot of labeling on this exam next week, and we'll have pictures where you have the entire body, and I hope nobody will be labeling things like a femoral muscle in your head or in your arms, because a femoral muscle like the biceps femoris is obviously going to be in your thigh, where your femoral region is. So just kind of think about that as you go through next week during your exam. Function, basically what the muscle's doing can be used in the name, like the adductor magnus, which is a big muscle that adducts your thigh, so it helps you like spread your legs. Flexor carpi ulnaris, if you kind of break that set of words down, will tell you that it is a flexor of your, what is carpi going to refer to? What are your carpals? Wrist. And then I bet you can figure out what bone it's near. Your ulna. Okay. So this is a wrist flexor that runs along your ulna. Shape of the muscle, like deltoid can be used. Deltoid means triangular, which you'd have to really know Latin to understand most of that, but that's okay. Direction of fibers, so how they orient themselves, like rectus femoris, which is that because the word rectus means straight. The number of heads, origins, or divisions, like biceps and triceps, where the suffix seps means head, bi means two, triceps and biceps have 2 heads and 3 heads. Tri means 3. Okay, 2 and 3 origins. Points of attachment can be used, like the sternocleidomastoid, which is attached to our sternum and clavicle, and the mastoid process behind our ear. And then the size of the muscle, where we use maximus for big or large, minimus for smallest, medius for intermediate, like your glute muscles. What are your glutes? Your butt muscles, there are 3 of those. Longus, pretty common sense, I would think, means long. Brevis, probably less common sense, would mean short. So now that we have a great idea of what we're talking about, what we'll be dealing with as far as names go, now we can get into actual identification of our muscles. Okay. To warn you guys, there's a lot. Okay. Now, how many named bones were there in the human body? 206. Anybody know how many muscles are in the body?
507.
507 is not a bad guess. It's actually more than that.
Oh, well, I thought that was a lot.
Somewhere closer to 800. Actually, a lot of muscles are really small, and like we have different numbers of muscles from person to person, kind of like how we have different bones.
My goodness, just a few.
Most of the muscles of the body, you guys aren't going to have to worry about. With that said, you're still going to have a bunch to know. Great thing is, I'm not going to worry about points of attachment like origin and insertion like a lot of schools do. I know for a fact that like K-State, you have to know not only what the muscle is, but you have to know what nerve innervates it, along with what it's attached to, its origin, its insertion, all those little points and things that we talked about, and you had to know for your bones, like the processes and tubercles and that stuff. That's really the big reason why you have to learn that before you talk about muscles, because that's where a lot of muscles attach. The main thing I'm going to focus on for you guys knowing are, yes, many muscles, some tendons, and other associated structures like tendons, like sheaths and aponeuroses. So I'm really kind of taking it easy on you. And since there's so many muscles and so much information in this lecture, it's 26 slides. I told you guys this before, but I'm going to pull 40 questions from this packet alone. So the exam number 3 next week is not going to be 40. 2020 is 20 to 40, so it's 60. Make sense? Okay. With that said, it's time to get your highlighters ready, or your starting machines if you don't like the highlights, or your underline, whatever you choose to do. We'll start on the left side. I'll just go down that side and then down the right side. The first thing I want you to highlight is just the part of the first word there. I just want you to highlight frontalis, because that's how I want you to know it. The frontalis. And then you can skip down to orbicularis oris, platysma. The latissimus dorsi I don't highlight here, but it is one we're going to know. That's a big back muscle, but it attaches kind of in your armpit, as you can see. So they label it, but I would never ask you to know it there because it's really too hard to tell. But do highlight the rectus abdominis, brachioradialis, externo oblique, my favorite muscle to say, the tensor fascia lata, iliacus, psoas major, adductor longus, sartorius, gracilis, vastus lateralis, rectus femoris, vastus medialis. I usually just call it the quadriceps tendon, but they have it listed a little bit fancier than that. Quad tendon also I use a lot of times. The gastroc and soleus, I'll wait and talk about those. Actually, go ahead and highlight soleus because you can see that pretty well. On the right side of the page, starting at the top, the epicranial aponeurosis, the temporalis, orbicularis oculi, masseter, sternocleidomastoid, trapezius, deltoid, pectoralis major, serratus anterior, the biceps brachii. I'll skip those next two, although we will talk about those. Pronator teres, brachioradialis, flexor carpi radialis. I'll skip flexor ulnaris. Let's go down to the leg, iliotibial tract. Next to patellar ligament, I would just put in parentheses tendon. That's how most people call it, patellar tendon. Technically, it is a ligament, but most people call it a patellar tendon. And then tibialis anterior. Now, what we're going to do is, zoom in at the head and look at, because some of those muscles are really small. Okay, same thing. We'll just kind of go body part by body part. Some more anterior ones, some more posterior. Highlights on the posterior view, epicranial aponeurosis again. Here's that same word that I pointed out that I just wanted you to call the frontalis. This time, write it out as that. So instead of calling it the occipital-frontalis, we break it into two parts. The frontalis is in our forehead. The occipitalis is in the back of our head. That's how I kind of want you to know it. So instead of having it or highlighting it as occipital-frontalis, write in this area occipitalis. I can go back so you can spell it. Okay, moving down, let's go to the trapezius, the deltoid, brachialis, triceps brachii, let's see, extensor carpi ulnaris, flexor carpi ulnaris, gastrocnemius. Soleus is too hard, so I won't worry about that. Calcaneal tendon. And the other side is real easy. You just highlight everything.
Oh, okay.
guys are probably feeling overwhelmed right now. But
Ready.
students typically do a lot better on this exam than they do on the bones exam, or they do equally well. Some people struggle with the bones and they kick the muscles' butt. If you do good on muscles, or if you do good on the bones, you'll probably do good on the muscles because you're doing well. But okay, are you ready to go body part by body part? Or region by region, whatever you want to say. We'll start with 4 muscles that move our tongue. Anytime you see the word glossal or glossus in this case, refers to tongue. Your tongue itself is an actual muscle covered with a mucous membrane. We'll talk more about the tongue later in the semester. Your tongue can change its shape, but to like move it up and down and swirl it around and all the fun stuff that it does, we've got these 4 muscles. Notice they all end with glossus. Okay. As far as the exam goes, I'm not going to worry about you knowing anything from this page.
Anything from the page? Or just
Nothing at all from this page.
Oh, okay.
Maybe someday if you go off to dental hygiene school, this will apply to you, but for a lot of people, these are very small muscles, and it won't apply to you. Okay. Now, whenever possible, I also included, along with the illustration, a table. It kind of gives you a nice breakdown of where the name comes from, its origins, insertions, what its action is, so what it does, and then its innervation. Like I said, at places like K-State, KU, a lot of this stuff is fair game for exams, and I am not that mean. You are very welcome. Now, I think there's a couple things that you have to fill in on this page.
Yeah.
For the most part, what we're just doing is highlighting, but there's a couple of times we have to write stuff in. So you have to remind me where you have to write stuff in.
Just those 2.
Okay, that's what I thought. Let's talk about facial muscles. Facial muscles are a little bit unique in that, muscles typically move joints. Well, facial muscles move skin a lot of times, and they provide us the ability to make facial, movements, smiling and frowning and scowling, raising your eyebrows and that kind of stuff. So their insertion origin stuff is a little bit different, okay? They lie within the subcutaneous layer, usually originating in the fascia or skull bones, but they insert into the skin. Okay? And as I just said, because of their insertions, muscles of our facial expression move our skin rather than a joint when they contract. Okay? Down here at the bottom, we've got a right lateral superficial view to show some muscles that are involved with what we call mastication or chewing. Okay? The major muscles that I'm going to focus on are on this page. This is a lateral view, just like that one, but a lot more is included. And then we've got an anterior view. I'll start here, though, okay? And then we'll talk about the muscles that are also listed on that page. Let's start, I zoomed in way too far. Let's start with the 4 muscles of mastication here. Now, what we've done is removed a lot of other muscles. We've actually removed the zygomatic arch, which is that bridge that connects the zygomatic bone to the temporal bone to the zygomatic bone, and we've removed part of the mandible so that we can see these what we call pterygoid muscles, the lateral pterygoid and the medial pterygoids, which you'll want to highlight, are muscles that allow you to open, protrude, and move your mandible side to side. Okay. You've got 2 super important muscles that really just move the jaw up and down. We only see one of them, though, here, the temporalis. And actually, it's been cut right there. This is that muscle that attaches to your parietal and frontal bones. Remember those temporal lines that you had to know? And that's where they originate, and then they insert down on our mandible. Okay. The other muscle that's very important for chewing is your masseter, but you don't see it labeled here. It's because it would be right in here, and we've had to cut it away so we can see these other muscles. Okay. The kind of tricky thing we see with muscles. A lot of times they are layered, like lasagna, where you've got a layer of muscle and then you peel that layer off and you got another layer and you got another layer underneath that. So sometimes we have to move muscles out of the way to see other muscles. Okay. Now, this image is also showing you really nicely what we call our buccinator muscle, a very, very important, they call this the kissing muscle because it helps you pucker your lips. Okay. It's actually really important in babies because babies get their nutrients by suckling, right? Okay, by puckering their lips and sucking. So I want you to highlight the buccinator, and then also the orbicularis oris is nice and visible as well. So there should be, I think, 5 things labeled or highlighted: temporalis, medial pterygoid, lateral pterygoid, buccinator, orbicularis oris. All right, let's focus now on the lateral view here, where we see a lot more, including the epicranial aponeurosis, which is basically just like a flattened tendon that connects the frontal portion of our occipitofrontalis, what I like to call the frontalis, to the back, what I like to call the occipitalis, which I would recommend that you write down here next to occipitofrontalis. Once again, spelled occipitalis. Which is obviously, since you're writing it in, something I want you to know. Above that, you can see very easily the temporalis, highlight that. So the first 3 things you should have highlighted or starred. You can skip down there to masseter, which really kind of looks like it's in a just right here area, but this is all masseter. So if you want to kind of draw the line up somewhere in the middle, might not be a bad idea. Kind of easier to show it that way. You can skip down to the sternocleidomastoid, even though that's not really a facial muscle, it's very visible here. So I want you to highlight it, along with the trapezius and the levator scapulae. Not important facial muscles, but important muscles that are visible because we've included the neck in this illustration. On the face portion of our figure on the right side, I want you to highlight the frontalis, the orbicularis oculi, which is nicely, easily spelled with an I at the end, and that's what it surrounds. Your oculi surrounds your eye. So that's easy to keep it separated from your orbicularis oris. Oral always refers to mouth, so keep those straight. Okay. The next muscle to highlight after orbicularis oculi is your zygomaticus minor. This muscle that helps along with the zygomaticus major to allow you to smile. So the next one to highlight is zygomaticus major. I can't remember which one it is, but one of them, in people that have dimples, it kind of connects a little bit differently, and that's what gives people those dimples. Like Myra Lopez, formerly known as AC Slater from Saved by the Bell. If you're familiar with that show. One of the best shows of all time. The buccinator, you can see here just kind of in the middle. Remember that was shown on the previous page. It's harder to see because we've got like the masseter in the way. Orbicularis oris. And then you can skip on down to platysma. All right, we've kind of got 2 parts to this illustration. On the right side of the face, left side of the image is a superficial view. And then we've removed some of the muscles on the left side of the face to show the deeper muscles. So starting at the top, epicranial aponeurosis again, frontalis again, temporalis again, orbicularis oculi, zygomaticus minor and major, and platysma. Now, later in the semester, we'll talk about this levator palpebrae superioris. That's what allows you to open your eyelid, your upper eyelid, that is. But we won't worry about it yet. Don't think that you open your eyes using this. This is like what allows you to like squint using your orbicularis oculi. This is what opens your eyelid itself. But don't highlight it yet. It's not something I'm worried about you knowing. Highlight the buccinator, the masseter, orbicularis oris. And then you can skip down to sternocleidomastoid. All right, really switching gears from the face, neck, head area. Let's talk about muscles that help us breathe. Anything to write on this page?
No.
Okay. So these are muscles of our thorax. Remember, our thoracic cage was the sternum, your ribs, and your thoracic vertebrae. Okay. These three muscles interact with our thorax to allow us to breathe. We have two sets of intercostal muscles. Now, what you'll see is a lot of these images are from a different textbook. I'm not in love with this image, but I actually like this a lot better than what you find in your textbook. One reason I don't like this image is because it's only showing you two pairs of intercostal muscles, external and internal. They show you only between ribs 1 and 2, 2 and 3, but they would be between all the ribs. Okay. The externals are farther from the sternum, whereas the internals are closer to the sternum. That's really the big difference between the two, along with the fact that your externals allow you to breathe in, like when you take a deep breath in, internals help you to take a deep breath out. But right now, when you're just like normally resting, breathing, you're really only contracting your big dome-shaped muscle called the diaphragm, which we've talked about before, is the muscle that separates the thoracic cavity from the abdominal pelvic cavity. Okay. All of this is your diaphragm. I'm not worried about the central tendon of it. What's cool about it, it actually has holes in it that allow like this big blood vessel to travel through. Your esophagus pierces through it. So as far as the image goes, just be able to identify external intercostals and internal intercostals, diaphragm. Anybody like to eat ribs?
Heck yeah.
Ribs, you're eating the intercostals of a pig typically. So I guess you can eat beef ribs, but they're not nearly as delicious as pork ribs. I just smoked some up here a few weeks ago. They were quite tasty. Anything? I think there's some stuff on this page. Can you guys read that okay, or do I need to zoom in further?
No, it's okay.
All right, let's talk about superficial muscles of our chest and abdomen, whereas these were obviously super deep because they're down there all the way into your bones. Not into, but around our bones, I should say. We've also included the shoulder here for the right side and the right upper arm, so I'll kind of point out some muscles there. So highlighting things, highlight the deltoid, the pec major, biceps brachii, Don't worry about that. Do highlight serratus anterior, although it's labeled here again, and you can really see a lot better here on this side. All right, into your abdomen, which is where really a lot of the stuff here listed on this page is all about. We show, this would be what it would be superficially. Once you get the skin out of the way, the muscle, the rectus abdominis is covered, and I would highlight, really what you're showing there is the rectus sheath. The rectus sheath, as you can see, is an aponeurosis that encovers, or encloses, not encovers, that's not a word, encloses our rectus abdominis muscles. Basically, it's just like a flattened tendon-like structure. Right down the center of our abs, because there's two rectus muscles, rectus abdominis muscles, splitting them in half is a linea alba. Think of that just like a line. You can't really see it so well here because this is so white, just like it. I've actually got a very similar picture to this. In a couple slides, you'll be able to identify it a little bit better. External oblique. This is kind of where your love handle area would be, as people like to describe it. And then finally, the bottom here on this side, I want you to highlight superficial inguinal ring. These are actually two openings at the bottom of your abs, which are super important in men, because this is how, okay, so how do I explain this? Even though the testes and the penis are so close to one another in a man, they're actually like just located near one another. They're really not that well tied in with one another. One of the first things they check when a little baby boy is born, and I've experienced it because I've got two boys, they check to see if the testes are in the scrotum. They feel for them. Okay. The testes actually originate and develop inside of the abdomen. Okay. And then they descend down through these openings on the way. So these actually connect to the scrotum. Okay. And so like, there's blood vessels, there's nerves, there's a tube that carries the sperm from the testes up into this opening, around the bladder, and then back down towards the penis. So even though the testes are right next to the penis, it's not a direct shot for the sperm to go from the testes to the penis. It's kind of cool. Kind of weird, but that's the way it is. We'll talk more about all that stuff when we obviously get to talking about testes and penis and all that. So that's the superficial inguinal ring. On the right side of our image, the serratus anterior is this jaggedy looking muscle. Serratus, think serrated. Anybody know what a serrated knife looks like? Serrated knives are the ones that have like the little teeth, little jaggeds. Okay. The external oblique, you can highlight it. It's been cut, so we can see some of those internal muscles. We talked about the vertical line of our abs. Now the horizontal lines, there are what we call tendinous intersections. And those give us our wonderful 6 or 8 packs that we all have. Except me, I do not anymore. Now we see uncovered the rectus abdominis muscle, which is called a rectus because the fibers are running vertically straight in a line. Deep to it, and we can only see it because we've cut away some of the muscles, is a transversus or transverse abdominis. It's kind of hard to show. I zoom in, you might be able to see it. You see the lines are now going sideways instead of vertically. Okay, your transverse abdominis is just deep to your rectus and it runs horizontally, whereas the rectus runs vertically. We can also see the internal oblique, which I want you to highlight, which is deep to the external oblique. And that should be it for this page. And with that, we are at 11 o'clock. So we will start with muscles of the shoulder girdle on Tuesday. We will pick up with this. We're not going to have the test on Tuesday.